Hi, this presentation is a situation analysis of Healthy Community Brookfield, also known as HCB. Today is August 16, 2017. I am Rakia Selman, and I am presenting to the HCB Board of Directors. HCB's history starts in 1998. It was formed as a freestanding, not-for-profit agency. Prior to that, HCB was a part of the local VNA, which is the Visiting Nursing Agency. And as a department, it managed 2 state contracts that dealt with intervention and prevention of cardiovascular disease in the population and health promotion initiatives throughout the schools in the county. The program's annual budget was $112,000. In 1997, a wealthy benefactor offered $2 million to expand the work of health promotion and wellness throughout the county. And with that, HCB was formed in 1998 with its own board of directors. The overview of HCB. HCB is a charitable not-for-profit organization with the purpose of promoting health and wellness to the county of Brookfield. The county has a population of 85,000, with the residents of Brookfield being blue-collar, working on farms and agriculture-related businesses. HCB provides traditional programs through contractual agreements with the county and the state. So the programs in HCB So since 2008, a couple of programs and services have been discontinued, such as nutrition education for teens, babysitting courses, group bereavement classes, and caregiver support groups. But currently, the programs and services that HCB provides are listed here: women's health and primary care medical services, prenatal and newborn care, mobile health medical services, employee health and wellness services to area employers, case management services for elderly recently discharged from the hospital, also violent prevention programs, smoking cessation classes, diabetes education classes for newly diagnosed diabetes, teen after school programs, school health, wellness and fitness programs, well water testing and water problem mitigation assistance, and vaccine and immunization services. The mission statement of HCB is stated as: we strive to improve the community's health by strengthening the quality and performance of health promotion and wellness practices. The vision statement states: the promotion of healthy practice leads to improved health behaviors and healthier communities. The values state that we value honesty and integrity in the services we provide to the community. We value high quality services. We value connectiveness with other community partners. We value our staff and their well-being. And we value being a public health leader in the community. So environmental factors. So initially when HCB was formed, they had their own board of directors that was comprised of influential community members that wanted to have their name associated with the organization. And so there wasn't any type of term limits. So most of the board of directors stayed on that board, and some even stayed for at least 15 years. Now, when they were formed in 1998, the former program director of the VNA was selected to serve as executive director. And that director was a registered nurse and primarily dealt with the organization as if it was dealing with medicine and nursing, and not necessarily public health and catering to the community and their needs. And when Elaine Caulfield became executive director, she hired her staff and former workers from the VNA to come over to HCB as a new organization. And there was no type of strategic plan or anything. And from there, when the $2 million was given to them, that dwindled out and was used over an 8-year period. And so it wasn't until 2008 when a chief financial officer and an experienced program planner came into the organization and kind of created programmatic and financial stability for the organization. And then from there, a strategic plan was developed, and it also discussed different grant fundings for specific programs, and then also the contracts with the county's health department. And from there, they obtained several state mandated public health programs. And they also were approached and had the allocation of funds annually. From an employee's perspective, HCB is a good place to work, but unemployment is unstable based on the funding cycles of the different programs and being non-existent sometimes. Also, employees feel like there's a hierarchy in the organization, with the medical personnel being most significant or more important, and then the other staff members are just seen as support staff. But from the community's perspective, HCB seems like it's doing good. However, many community members do not understand what the organization actually does. Also, some of the employees are not clear of the mission, the vision, and the values of the organization. And also, other community members believe that HCB is still that department that's a part of the VNA. But based off of that, there's still a positive image as well as a good perception. Financial stability analysis and concerns. Personally, I believe the financial issues began when the $2 million dwindled over the 8-year period. And from there, I believe it was a struggle to first regain and regrow the money that was necessary, but as well as to get the support of people. And you can't really get support if the community doesn't understand or know what you're doing. And so when they know what you're doing and they know you're fighting for a purpose, then people are willing to say, hey, I will give you some money. But most of the funding and the money in the organization is just dependent upon the allocation of the county budget as well as grant funding. And if the organization does not apply for as many grants, or grants that will kind of automatically apply to them, then the funds will not be existing. And although in 2008 the chief financial officer and planner kind of got the stability of the finances on track, I believe since there wasn't really great leadership or passion about the organization, that all of that structure has fallen. And so that's the main issue with sustainability of the finances for HCB. And then also talking about the accreditation by the PHAB. which is the Public Health Accreditation Board. Um, once the once HCB did not meet the requirements or one of those standards, um, that threatened funding as well. And so, if um, the lack of accreditation will affect funding, then the program will be non-existent, maybe eventually. Okay, and so now I'm going to go into the strengths of the organization, and this is basically based off of a SWOT analysis, which deals with the strengths, the weaknesses, opportunities, and threats of an organization. And that also deals with their internal and external factors. So the strength of HCB is that the organization staff, the members, and the board of directors are viewed as dedicated, hardworking, and knowledgeable, as well as there's a positive image of HCB based off of the perception that the organization is still a part of the VNA. Also, employees deem this as a good place to work, and the perception of the community members is that the organization is doing good. However, there are some weaknesses. The weaknesses deal with the community lacks the understanding of what the organization does. So even though the organization has their mission, their vision, their goals, their purpose, the community doesn't really understand what the organization is doing. Also, there are confusion about the programs and services. The board of directors advise to seek grant funding regardless whether or not it aligns with the mission, which can be an issue, and that's dealing with people in leadership and things like that. You want to always make sure that whatever you do is aligned with your mission, your vision, and your goals. And that may be from a lack of strategic planning. Also, the employees are unclear of the true mission, vision, and the values. And so I believe the unstableness and the instability may be due to employees just coming to work. They know they have a job to do, but they don't understand and do not have that passion because they truly don't understand what the mission is, what the vision and the values, the goals. What is the organization trying to do for the community and in the name of health? And also, the organization is described as a ship without a navigation system. Okay, so the organization is here, but it has no structure, no fine leadership, and just nothing to work with. There's no type of stability going on. But there are opportunities, and the opportunities deal with the Public Health Accreditation Board standards and the measures development, reworking the mission and the vision, also continuous quality improvement and development, and employee training. And so using what they have, tweaking it a little, and becoming better. And so the threats are the key stakeholders question overall mission and the purpose of HCB. So local hospitals, law enforcement, and things like that are not understanding what the organization is doing. Also, the possible termination of contracts by the county's health department due to the accreditation standards. Okay, and then based off of funding cycles, employment is unstable. So say if the program for violence prevention has ran out, so those employees, so it's instability. You don't understand or know what's going to happen. And then also the employees' perception of hierarchy at HCB. Even though there are hierarchies in different positions, staff members shouldn't feel threatened to that. Okay, so the recommendations, action, and areas of focus that is necessary for HCB. The first thing I believe is leadership. So having someone in that leadership role that's able to guide and who has a vision of creative and intuitive innovations that will get the organization back and growing. Also, someone who has expertise in this field, someone who's able to motivate, to engage, and be passionate about the organization as well as the staff members and the community. And then getting people on board, not necessarily getting experts or experienced staff, but getting people that's willing to be trained, trainable staff that's willing to learn and develop a new way of the organization, changing it up, doing different ideas, doing creative things that will promote growth and also the purpose of the organization. Also, applying for different grants and things like that. And I think that comes from establishing relationships and engaging the community. So once you establish the relationships with the local hospital, a better relationship with the hospital or different types of health organizations, then those partnerships can be an opportunity and a connection to funding and financial assistance. Also, using social media, getting the word out, getting what you're trying to do out. Even if there's hosting an event that deals with diabetes or something centered around just being present in the community, will get the support of people, and then that support can turn into financial support. Okay, next steps. I think next steps, strictly dealing with a clearer and a more defined mission, vision, and values. Even if HCB still works around what they have, just make it clearer that the community understands, the organization itself understands, and that the employees understand. And once you have someone in leadership that can possess those qualities and demonstrate that, then the employees will then get in line and be aligned with that. But your employees must be aligned and also demonstrate the vision, the mission, and the values of the organization. And from there, commitment will come out. And once commitment comes out, then the growth and all of the necessary things will be together. But I think that has to start with a plan. Maybe a team that's strictly focusing on this, presenting it to the staff in the organization, and to become better. Also, creating a strategic plan that's based on the purpose and the goals of HCB. I know one of the purpose is dealing with promoting health and healthy behaviors. So how can our plan be designed around the community as well as what we want for the community? And I think that deals with, again, building relationships, building partnerships, being visible in the community so they understand what HCB is really trying to do. And then also funding opportunities, just finding opportunities that funding will be available, even if it's a wealthy benefactor in the county or in the state, within the local hospital, within local law enforcement, within whatever other health organization there is. Writing letters, promoting what HCB is about, what they're trying to do. And I think the funding opportunities will come. With the strategic planning process, just basically getting started. And how do you get started? You plan your team, you create a schedule, and gather your documents. Gather the things that you know you will need. And from there, determine a position. Discuss your strategic issues, your community insights. Get also your employees' input. And then the SWOT analysis. Everything dealing with the strengths, the weaknesses, the opportunities, and the threats. From there, develop your strategy. What will be your mission? What will be your values? your vision? What is the organization's wide strategies? What are the long-term objectives, short-term objectives? What are the advantages? And from there, you want to build the plan. Okay? And in building the plan, you have to use your SWOT analysis. Okay? Also, what are the goals of HCB? What does that look like? Also, the budget and your team members' goals. And from there, you're going to manage your performance. So set a calendar, adapt quarterly, update annually. And so I think the problem in the past was no strategic plan, as well as no growth. Out of the whole thing, I didn't see any growth as far as, well, we're not getting funding, so we're going to switch this. We're not getting programs, we're going to switch this. So I think that's what needs to be done in the strategic planning process, and how things will evolve and be better with HCB. Okay, and the necessary funding to complete. So I believe once the organization established its purpose and it surrounds its purpose in the community, greater partnerships will arrive, as well as the participation and relationships of community members will draw from there. Also, again, the organization applying and just looking at possible grants. Not only that, just being, again, visible in the community. And from there, the funding will help the necessary things, the available programs that may be in jeopardy. And then also that will help with establishing new and necessary programs that may be needed in the community for different community members. But I think in order to do that, you need to recruit a leader. And so the question would be, what type of leader do you think would be best for HCB? Does that mean a leader that has integrity and pride? Someone who is experienced? And also asking the question of how and where does the company want to do? What do they want to do? Where do they want to go? What is the growth? What are the goals of the organization? And so I think once all of that is established, then the goals of funding and the strategies to get to funding will happen. Thank you.